prevents the bone formation. So I'm thinning and thinning the sealing of the defect, removing the connective tissue as much as possible. And then I am elevating the flap again. Then I'm elevating the floor of the sinus distally, and I'm root planing the teeth, maintaining the 1 millimeter of attachment. Then I decided to place 2 screws. Of course, you cannot place the screw in the ceiling because it's too long and you don't have bone here. So I placed 2 screws in the mesial and the distal wall of the defect to the right level, to the level where I want to regenerate the bone, up here, close to the surface of the root. Then I made as much as possible over the perforation of the cortical bone, and here I'm thinning the palatal aspect of the flap because I want to remove all the connective tissue that could make too much pressure into the defect. Then I'm placing the membrane with the tags in the palate. Once the 2 tags in the palate has been placed, I start to place the mixture of autogenous bone chips and bios that have been soaked with PDGF. You see they are very white because they are soaked with PDGF, and but you have to be very careful before closing the membrane that you have blood in that particles. Not only PDGF. PDGF alone doesn't work. It works if you have the blood clot. So sometimes we take blood from the agitation area, sometimes we take blood from the veins of the patient. Then the membrane has been fixed buccally, and you see that the flap is not coming at all. So this is the periosteal incision to release the flap. This is the technique. With your left hand you pull the flap, and with your right hand you make a continuous incision in the periosteum at the base of the flap, up there, not here, but as apical as possible, and you have to make a continuous incision from the vertical cut in the mesial to the vertical cut in the distal. And then you continue to cut to be sure that the periosteum is completely released. If you have just a half a millimeter of periosteum intact, the flap is not loose enough. So now the flap is much more elastic, but still I need more tissues. So I'm doing that famous periosteal flap. So I make a vertical incision. Oh, sorry. Blah.